Medical Association has called on government to enforce stricter lockdown measures, saying some members of the public are not adhering to COVID-19 health protocols. South Africa is operating under lockdown level 2 amid the third wave of the coronavirus in parts of the country. The health department has recorded more than 5,000 new daily cases for a third consecutive day. Earlier, we spoke with the South African Medical Association's chairperson, Dr. Angelique Coetzee.
With the limited vaccines that we currently have, we are trying to vaccinate as much people as possible and then extending the second dose to 42 days with the hope that when the 42 days start, it will be close to July when a lot of vaccines is going to come in. So we're trying to vaccinate as much as possible, but it is safe to wait 42 days for the second jab.
All right, another confusion, not really a confusion, but just some clarity needed on the third wave. We know that, for instance, we're seeing high numbers in Gauteng, and we also saw those numbers rise up in the Northern Cape, which was not previously seen before. Talk to us about where the country's at the moment. Are we on the third wave currently, or are we still seeing some pockets of provinces being there already and starting to come out of it?
So from SABC side, we are saying unofficially we are in the third wave. Officially, we are nearly there. They're waiting for 6,000 per day, and then they will declare that it's officially we are in the third wave. We're not going to get out of it now. We are in the beginning of the third wave, and it's still going to be with us. I think the projections is that we will reach the top of the third wave sometime next month in July. So for now, we are moving in. We're not moving out of any wave. We are going into it. And that's why, again, the restrictions regarding, people coming together, it is so important. Actually, to tell you the truth, if people did listen and didn't go to the parties, didn't do 40 days, the school children, they just listen to what we have said, it would not have been necessary to go up here, to increase the curfews at night. Nothing of this would have been necessary if each and everyone just did or play their part that we keep on asking them.
But having taken everything that you have just said in this interview, how far are you engaging with authorities that could actually make these measures that you are suggesting even tighter? Because, if you have to look at some of the constraints that we are facing in the country at the moment, and taking into consideration that many of our grade R's and 7 learners will be going back to school in a couple of weeks' time, it will probably accelerate those numbers too, don't you think? So how far are authorities actually taking this seriously?
Well, there's so many crises going on in the healthcare. I'm now talking in National Department of Health with this, this investigation. It's the investigation in the affairs of the minister. It is the investigations in the corruption center. It is the investigations, there's not enough water, there's not enough electricity. If you look at the healthcare sector currently, it's a very sad picture. So if we so on top of it, we have the winter, we have the cold weather, we have children going back to school. I'm not even sure whether there's water at all of these schools. So we really are moving nicely, as I have mentioned before, very nicely into the eye of a storm.
Travelling theatres, arts and music are being